Welcome to the second episode in the School of Thought series presented by HP and Global Tech Advocates. As a part of today's session, our panelists discuss managing demand, hypergrowth, and innovation in healthcare. Please welcome our special guest moderator for today, Jack Davis, founding member of Global Tech Advocates and director at Seven Hills.
My name is Jack Davis, and welcome to School of Thought, Managing Change in the Age of Hyperacceleration, a new webinar series from HP and Global Tech Advocates. I run the tech practice at Seven Hills, a campaigns and communications firm in London, and I'm a founding member of Global Tech Advocates, the international grassroots tech community representing networks of entrepreneurs, tech leaders, and investors in more than 20 tech hubs and regions around the world, all acting in a voluntary capacity. Global Tech Advocates has partnered with HP, one of the world's most respected and influential technology companies, to enable peer-to-peer learning across an international community of IT leaders. Over the last 4 months, Global Tech Advocates and HP have been conducting a series of interviews with large and mid-sized businesses across multiple sectors and geographies. We have been speaking to CTOs, CIOs, and tech leaders on the front line of the dramatic changes and disruption caused by the global health pandemic. The common theme that emerged was the hyper-acceleration of digital transformation. As one global business told us, digital transformation that would usually take 5 years has been completed in just 2 weeks. Through this webinar series, we want to share insights from IT leaders about this age of hyper-acceleration, looking at the trends affecting all of us and the sectors experiencing the most dramatic change. This webinar will focus on managing demand, hypergrowth, and innovation in healthcare. A few sectors have experienced such rapid transformation as healthcare in 2020. IT leaders have had to manage wholesale infrastructure transition in the face of unprecedented global demand. Never before has it been so important or so difficult for people to have access to healthcare services. However, as any entrepreneur would understand, alongside challenges there are opportunities. Governments are investing heavily in healthcare companies. Demand for healthcare services is higher than ever, and digital health solutions are being adopted at scale. So to discuss this demand, growth, and change, we are joined today by an illustrious panel of healthcare and health tech experts. Jason Foster is the Managing Director of Health Equity Consulting, a healthcare growth consultancy, and the Chief Executive of Ori Biotech, which enables patient access to cell and gene therapies. He is a prominent figure in London's health tech sector and leads the Tech London Advocates Health Tech Working Group. Mindy Dashner is a health tech entrepreneur. She runs Dashner Consulting, which works with health tech startups to develop product, commercialization, and brand. Mindy was also the founder of PS Health and the Chief Commercial Strategy and Marketing Officer at DrLink. And Alexander Davidge is the Interim Deputy CIO at HCA Healthcare UK, the leading private healthcare provider. Alex was previously Head of Business Architecture and Strategy Development at Bupa, the International Healthcare and Insurance Group. Before we ask the panel about what the extraordinary events of the last 6 months mean for healthcare, I would like to introduce Daniel Colling, who is HP's Global Lead for Healthcare Industry Solutions. Daniel will be our HB host for this webinar. Daniel, it would be great to get your perspective on the changes you've seen in the healthcare sector and what they mean for IT requirements.
Well, thank you very much, Jack, for having all of us on this webinar today, as well as a thank you to all of the group and the panelists that are participating. At HP, I have the privilege of being the global head for our healthcare industry solutions, and I am responsible for leading our healthcare strategy, our research and development, technology and solutions, really designed around enabling health systems throughout the world to achieve their initiatives. And so those initiatives in healthcare, they focus around patient safety, clinical efficiency, as well as truly with the economic results that we're starting, or effect that we're starting to see from this global pandemic. We really need business value that can connect care between care providers and patients. So thank you so much for having me on this call.
Thank you, Daniel, and we'll come back to you throughout the discussion for more sort of input. So turning to our panel, I want to start with a sense of everyday life this summer in your organisations. So a sense of what's changed for the healthcare sector over the last 6 months, and more recently, what does the return to work look like for you, your company, and the companies you advise? So Alexandra, if we start with you, and then we'll get inputs from Jason and Mindy. So how have you had to adapt from an IT perspective, and are you back in the office yet?
No, not back in the office yet. I think there's kind of two splits within the healthcare provision world. You've got your clinical workers and you have your kind of, I guess, typical kind of knowledge workers, office workers. Since the beginning of March, the one thing which has been a noticeable shift for IT as an organization for us, we just completely restructured and reorganized the moment things hit. So we broke ourselves into kind of response teams, coordinated around particular focus areas, around clinical care, infection control, things along those lines. That's been hugely successful. We've got 6 hospitals in London, and we have 0 kind of patient infection transmissions for any patients in our treatment. So we've been very kind of COVID safe. I guess the thing which has probably been the most dramatic as a shift, and it's probably a very familiar story for other industries as well, is the virtualization of so many interactions. So wound examinations for patients who are post-surgery with nurses being virtualized, MDTs, tumor boards, cancer boards with doctors, your typical GP or consultant patient interactions, as well as all the kind of the knowledge worker kind of remote virtualization. I think where that's been such a kind of dramatic shift from an IT perspective in healthcare is the healthcare industry, certainly the provision industry. I don't think anybody would argue is a laggard industry in terms of technology, in terms of systemic technology adoption, possibly even slower than governments to adopt new IT paradigms and new operating paradigms. So we moved to the point about 5 years. Within 2 years, we virtualized a whole bunch of stuff out the wazoo, and that was really interesting because our starting base wasn't a fully hybrid cloud environment with everything already up and running. This was build the Colosseum and you're standing there with a bucket and spade and saying, we've got to change and we've got to change things quickly. So a lot of technology adoption, a lot of great partnering with kind of IT, suppliers and partners. That's critical. I think realistically, you're not going to do this with no matter how fantastic they are, you're not going to do this with a DevOps team. But I think the other aspect is you have to really stop and say, how are you organized as a function to be able to respond? And we had to completely reorganize. So we've kept our operations, our guys who are still on site in the facilities, our nurses, our site techs. That's all been, kind of maintained and managed. And we've tried to kind of maximize distancing for our patients, for our partners and for our employees as much as possible. And that virtualization in an industry which isn't known for even getting things off paper. That's been the bulk of our spring and summer.
I guess on the one hand, that sounds like an enormous challenge that you sort of had to overcome over the last 6 months. But then at the same time, I guess there's that sense of virtualization and adopting new technologies. I'd imagine is something that you've wanted to do for some time. So presumably, all of those barriers just sort of fell away.
Yeah, absolutely. Our roadmap has a lot less on it than it did in the end of
February. Okay, thank you. So, Jason, if we could turn to you. So I know you have sort of a unique overview across the healthcare and health tech ecosystem in the UK. What are you seeing in terms of this period of sort of hyper growth and innovation?
Well, I think it's interesting that necessity is the mother of invention, right? So we're all running fast, trying to adapt and cope. Having spent 20 years in the healthcare and technology field, you feel a little bit less like you're banging your head against the wall every day, where some people are kind of running alongside you, as I think Alex was describing. I think it's very different from a larger established organization like HCA to the startup world. Ori Biotech, for example, is a cloud native company. We use Dropbox and Zoom and Microsoft 365 as our core operating system. So we were built that way. So maybe it was a little easier for us to adapt to the kind of knowledge worker exercises that had to happen and to keep things going. Where it gets really interesting is when you think about we work in the cancer field and immuno-oncology. I mean, globally, clinical trials were stopped for many months, and some still are stopped. So you think about the kind of wet lab work, the work that needs to happen in the clinics and with patients and with patient samples, and you have to get creative on how you continue that very important work through a global pandemic, which none of us have ever had to face before. So, I think we did things, basic things like, putting the lab staff on shifts where they were in the lab each kind of individually, and then they would cycle through their work during the day, but there wouldn't be overlapping shifts, for example. But it's had to cause the whole industry, I think, to think very differently about the way they work on a day-to-day basis and to leverage technology in different ways. One of the questions I hope we'll get to today is how much of it do we think sticks beyond this acute phase into a more systemic change? I think that's an interesting one to digest.
Absolutely. So, Mindy, I know you've recently released a report about the impact of COVID-19 on the healthcare sector and interviewed a range of global leaders to get their view. I think the header of the introduction of that report actually is "Necessity is the mother of all invention," as Jason just mentioned. So can you tell us, what are the findings of the report and how do they reflect sort of what you've seen and learnt over the last 6 months?
Yeah, thanks, Jack, for that. It was really interesting because I think COVID obviously was a wake-up call for not just the health industry, every industry, and on an individual level and a family level. But Dashner Consulting, we took this opportunity because we had some time. I think what COVID did is it slowed things down. In some instances, it speeded it up. But to really go back out into the industry, and we did a research and a survey that cut across 150 senior executives, both in the private and public sector, as well as digital tech, to really see what the impact is. And just to step back before I move forward, is that, this has had a profound effect on healthcare. Not only from a private and public sector, and I'm speaking more from a UK perspective than internationally or US, although I am an American by my accent and also from where I was born. But we are seeing public and private sector negotiate massive contracts in a matter of days for capacity. We have seen in the UK actually turning off all elective surgery and making capacity only for COVID patients. It's had its pluses, it's had its minuses, and we have tons of capacity and also more people with the ability to actually see patients. So there's a buildup now on waiting lists. But what it really has done is it's turbocharged the whole virtualization. The virtualization from a primary care sector of virtual consultations and digital triage. That was something I was involved in with another company in a private equity around that. And we're seeing just a massive takeoff that from 2% to almost 95 to 100% utilization. So much so that they're now saying, is this the way we want to stay? And that represents other challenges in relationship to actually getting face-to-face back online. We've also seen that happen within the secondary care for outpatient with regards to consultations. So it's had a massive impact across the board. The biggest one being the virtualization of care and then bringing in around the virtualization of resource, which healthcare is a place-based business. So that's fundamentally changing a lot of things. But what it's also done is it's thrown out enormous amount of weaknesses. And the access to real-time data, what that means to planning, what that means to pandemic, what that means to actually being able to understand who you should shield, who you should not shield. Here in the UK, that's thrown up enormous challenges. Not all have been met exceptionally well, but I think what it does mean for the future is that we've got huge opportunities for innovation and growth. And I think real-time data has been one of the biggest areas that I think we're going to see innovation as well as diagnostics, testing, and operational efficiencies and performance. I mean, I can go on and on. But I've talked to a lot of, healthcare people out there in the field, both from a private and public sector. And I think the biggest challenge now is how do we turn the system back on? And how do we get people really moving? And are we really going to stay in this virtual world forever? And I think Jason mentioned that. So I think there's going to be an enormous amount of change coming down the pipe. But I think we can't look at it in a 6 month. We need to look at it in the next 2 to 5 years.
If I could maybe branch off of what was basically talked about from Jason's perspective, right, as well as from Mindy's perspective, and to bring a clinical perspective, me being a clinician. So one of the areas that hasn't been discussed, we talked about telehealth, virtualization, bringing that patient to the physician or to, for example, the nurse practitioner in a very meaningful experience that they can accomplish this right within their home, clearly for increasing patient safety. There's, as everyone has seen this unravel from, the first documented cases in the Wuhan province in China. And then I believe it was in January, I can't remember the exact date, it could be, I believe it's around the 20th or 23rd of January, the World Health Organization declared that COVID-19 is a pandemic and it's a global public health emergency. And so what we quickly realized was the gap or the shortage when it comes to the supply chain that we've established globally, so just-in-time supplies. The also mega trend of truly a globalized environment, so that you have suppliers in multiple countries, and what that impacted was something very significant, which in previous pandemics we didn't experience before, was the safety of the clinicians interacting with patients, specifically around, for example, protective personal equipment, so PPE. And so in addition to that, we quickly realized we had insufficient ventilators, right? And so we had to create temporary ICU units with modified droplet isolations. And then you take everything on top of that, a shortage of physicians, nurses, and respiratory therapists. We've been talking about, prior to COVID-19, over the past 12 years, about care provider burnout. So we have an exodus of physicians leaving the medical field, bedside, going to potentially work for companies like HP, as an example, or some of your other technology companies that we see. And the reason being is, they feel that they're not getting the satisfaction out of what they have originally put into. They are completely exhausted. And so you add this pandemic of shortage of clinical staff to address this patient demand, and then all of the the just-in-time demand for supplies. Health systems that have been able to be very nimble have just shown incredible real-time changes for protocols, for example, for clinical staff. But with that in mind, we do see, clearly that we have seen potentially medical errors that can occur from that. So I think the technology that, as an example, telehealth, that's been accelerated exponentially. I think CMS, prior to COVID-19, they were in the tens of thousands of virtual consults and, per week. And we are now in the millions in the US, as an example. But with that in mind, a lot of the regulatory requirements, for example, looking at HIPAA security rules and requirements, we had to look at that and go, hey, what's the better of the options? Providing virtual care, right? And really relaxing some of those HIPAA security rules and policies put into place to maintain our medical records, which are the most valuable record that data that's there, or do we remove or relax some of those? And so, as an example, HHS as well has moved forward with, yes, we are going to relax those standards. So it'll be interesting to see the impacts later on of potential increased cybersecurity attacks, right? Potential fraud, which is a real scenario in the U.S. and Canada and Australia. People utilizing medical records that that are not their own. So it'll be interesting to see the impacts of, we clearly have to put the patient first and the safety. And so we've accelerated all this technology, which is wonderful, right? But what kind of impacts are we going to see from this as we start to get to the new normal? Because we're never going back. there is a new normal that we will be experiencing in healthcare, trying to deliver care to our patients.
Thank you. And I'm just staying with you, Daniel. I wanted to get a sense of sort of how specifically you've been working with HP customers and clients during the pandemic. But just building on what you were saying, are your customers now asking you those questions about how we, ensure security and resilience of the systems that we've had to build so rapidly?
Sure. So since the novel coronavirus was declared from the World Health Organization truly a global emergency, what we've done is, we've been able to leverage a lot of the technology that we invested in. If we look at in 2016, HP kind of came out of nowhere when it comes to 3D print. And in the past, 3D print was looked at in healthcare. Some health systems or hospitals throughout the world has utilized 3D print for anatomical models, for surgical planning, as an example, or to improve and inform consent. But with this just-in-time supply shortage, every single hospital in the entire world was scrambling, right, on how can we fulfill how can we bridge the gap in the supply chain shortage. And so in a very quick manner, we were able to assemble, it was over 1,000 HP employee volunteers, and we set up a 3D print global community and ecosystem. In addition to that, we had over 50 partners join us in this effort to design and produce 3D printed parts. And if you had 3D printing capabilities, what we enabled is with these 15 new applications that we developed, you could just download them as well as be able to 3D print those within their facility. If you didn't have those, if you didn't have the infrastructure for example, 3D print, we were able to reach out to many of our partners that are utilizing HP technology. An example is Smile Direct for Invisalign. I don't know if you're familiar with that in the UK, but it's quite large in the US and Canada. But essentially, you don't need to see an orthodontist. You can have your Invisalign braces or orthodontists be able to be 3D printed. So we shifted from Smile Direct printing Invisalign orthodontics to 3D printing face shields, as an example. Or another example is 3D printed masks. Another area is we had a massive shortage when it comes to nasal pharyngeal swabs for critical testing. And this was experienced in Europe, this was experienced in Asia Pacific, as well as North America. So what we did is we partnered with healthcare organizations like, for example, the Mayo Clinic, which is really a world-class renowned healthcare organization for innovation, as well as Beth Israel Medical Center. And we developed the first FDA-approved emergency use authorized 3D printed nasal swab. So, if you're able to utilize the application, there's no cost to that, as well as if you don't have that capacity, we've partnered so that you can utilize other 3D printed type partners to be able to do that. And in addition, we wanted to ensure, as Mindy just pointed out, I believe, elective surgeries were suspended. This wasn't just in the UK or Europe. I mean, elective surgeries pretty much globally were shut down, and that's the most profitable revenue stream when it comes to healthcare, whether you're a single payer, right, or whether you are a for-profit medical organization or healthcare organization. So we were able to, I believe we're up to now over 2.3 million PPE parts, like face shields, that have been donated. And one area a lot of people, if you're not a clinician, you probably don't understand, but wearing a mask for 13 hours a day, it can start to chafe on the ears. And then that can also increase potential infections with an open wound such as that. So one example is really comfortable mask adjusters that can fit comfortably around the ears was another innovation that has been really well received from the entire healthcare community. And then lastly, I just wanted to touch base on, we mentioned vaccine research, trying to truly accelerate that. And everyone, there's so many universities that are looking into how can we partner with large pharma companies as an example. We're not there yet, but HP, we invested significantly into what's called microfluidics technology. And essentially that was utilized for speeding up research when it comes to testing for a drug that, for example, Pfizer or Bristol Myers Squibb would be bringing to market. So what we've been able to do is we've been able to shift that, be able to donate a lot of this technology. These are called digital dispensers that really they're able to miniaturize qPCR assays at a really precise dispensing level. So at the picoliter level, which is extremely small, if you Google that, and this really has been able to eliminate the serial dilution from the workflows. So typically, a lot of manual pipetting is occurring. We've been able to utilize microfluidics technology alongside robotics to really accelerate vaccine research. And with that, we've received great results or great feedback to state, we've been able to decrease that potential research from, it may have taken 12 to 14 months all the way down to 3 to 6 months of manual typical pipetting that you would have to do to bring a vaccine to market. So there's just some areas that HP's participated with healthcare systems throughout the world.
So you've been busy then?
A little bit, yes.
From the sounds of it. Brilliant, thank you. Well, look, I want to move on and think about sort of the challenge that everyone is facing in managing this safe return to work. And Alex, I'd like to start with you and get your views on this, but there's a sense that all companies are having to adapt to sort of new levels of employee safety and to address infection prevention policies and protocols that usually you'd only see in healthcare facilities. So I thought it would be useful for people listening to this webinar who perhaps are not operating in the healthcare sector to understand, how hard it is to create these sorts of environments, and consider that level of sort of employee safety, and also how to create those environments from a sort of technical and IT perspective.
Yeah, so I think there's a couple of things which I think are probably advisable, and it's easy, as you say, probably from being within inside a kind of a clinical environment to it's just business as usual, right? But it's a step change from your normal kind of health and safety view of different coloured chopping boards or different coloured fire extinguishers and an hour of mandatory e-learning every year to know how to operate a ladder and things along those lines, which typically people have, which is a kind of an abrogated sense of responsibility. Really, it's the government tells us to do it. It's a degree of safety. We kind of care about our people, and we need to do that. What you're really kind of dealing with here, and I guess it's both not just in the return to work environment, but also for workers at home. There's a few considerations that I think are kind of really key. So the first thing is you probably actually need to have a deep, hard look at yourself as an organization and say, why are you thinking about this? So are you thinking about this from a purely commercial perspective? Our business is going down the pan, we need to get people moving. Are you thinking about this from a perspective of actually our business relies on its workforce and actually we really need to keep them safe? We really do value our people because the reality is, depending on the size of the organization, depending on the culture, familiarity, that is a spectrum, right? If you have a management organization which genuinely cares about its people and its welfare and is seen to, they will be trusted by the employees, and any policies and procedures you put in place for them will be followed, right? Because they will believe that the organization's got their best interests at heart. So I wouldn't discount having a bit of a look at yourself and understanding who's the trusted voice in your organization for engaging with people on that. In terms of some of the practical aspects of applying it, realistically look to external expertise. Every industry and physical environment and workplace is going to be slightly different. In the pre-pandemic environment, and I'm sure people have always been bamboozled why you can go to a restroom, use the facilities, wash your hands, and then have to pull the door on the way out, right? So there are just fundamental things about environments which already don't work in terms of keeping them, entirely sanitary. So get an expert in; they'll do that risk assessment. They'll advise on what needs to be done within your specific workplaces, and you'll also have experts who'll be able to advise around what you could be doing in your kind of home environment for, back pains, issues with, posture, your classic occupational health for home workers. So some of that really is just an amplification of some of the things that organizations already do, but you're looking to maybe a different set of experts. You're maybe not just looking to a construction or health and safety expert. You're maybe looking to bring in some infection control, clinical advisory expertise as well. Strongly recommend it. It gives you peace of mind. It will give your employees peace of mind as well. The aspect, I think, around where IT can play a role in that, and there are some really kind of basic things that can be done. Whatever you put out on there on day one to enable a safe return to work, the context in the environment and people's concerns, your employees' concerns and their behaviors will change. They will become more slack or more worried, or workloads will increase, and so they'll circumnavigate or skip some of the procedures because they're in a hurry. So you really need to make sure that the feedback loops, and IT is perfect for this, right? So ideation challenge platforms, there's a whole range of them out there. Getting those capabilities out to your people, enabling them from wherever they are located to constantly feedback and say what is or isn't working from a welfare, from a safety, from a perceived welfare and safety perspective. Get that information in and get your top tiers of management looking at that information and actioning it, because it will be a mutable situation. And I think if you have that type of expert baseline at the beginning, and then that constant engagement with employees to understand what is and isn't working, and you're only really going to be able to do that, with IT capabilities, that's going to really, really help. I mean, there's lots of, I guess, more point solutions from an IT perspective which could be applied, but really it's a cultural and it's a behavioural piece, and that's mainly going to be driven by having visibility of that, which means digitizing it, which means data, which means getting hold of that information and being able to act on it as a management team.
I guess probably thinking too overly optimistically, but I think we know that historically an organisation like the NHS has proved a challenging customer for startups and small businesses. But given this, we're talking about this period of hyper-acceleration and digital transformation, it feels like hopefully some of those new behaviours within sort of an organisation of the scale of the NHS, of having to look differently at its procurement processes and reach out to smaller businesses that have the innovations they need. You would hope that some of that would stick.
I think it's plausible, but I think what we also need to recognise is the NHS is not a single organisation, right? It's like looking at the US and saying it's a country. It's full of states. Every trust has its own different model. Every commissioning group, every purchasing group looks different. And an aspect which I hope it's minor, right? Optimistically, I hope some of these things stick or they drive further transformation. But when you look at a lot of the virtualization which has occurred in the NHS, a lot of that has occurred because technology organizations quite shrewdly have turned out and said, okay, here's a whole bunch of capability which allows you to virtualize your interactions with patients with each other, and we'll give you that for free for the next 6 months, 12 months. And maybe they'll get used to it and it will stick, and the switching costs will be too high, and then they can pay for it and it's okay. But there's equally the possibility that maybe a worst case scenario, some but not all stick with some parts but not all parts. So then you don't even get the learning capabilities around having those things stick from trust to trust. So I'm a little bit skeptical because it's far less of a standard organization than people think. And it's that difference in standardization, which means some trusts will be very progressive and say, actually, let's double down on what we're doing here, and actually let's move things even more progressively forward. And other organizations will possibly turn around and say, how do we get back to exactly what we were before and get rid of this terrible new technology and virtualized environment we find ourselves in?
You can change behavior based on repetitive, actionable direction. Like, first, how do you wash your hands correctly? Many of us don't know, right? And then secondly, following through with, if there are industries that do have to go back to work, manufacturing, they have to go back to work in a factory, whether it's a meat processing plant, whether it's a vegetable processing plant, whether it's a car manufacturing plant, they will be interacting with each other. There's been some great policies and protocols that have been put into place, but I am optimistic that outside of healthcare, you have everybody, whether it's in their home, whether it's in their school, whether it's in the restaurant that they're going in, is practicing proper basic hand hygiene. And then Jason brought up a really great point, and you did too, Alex, is then the next is, and so that's for transmission vectors, really reducing those transmission vectors. The second is reducing the transmission of pathogens from fomites. So those are surfaces. So Jason, you brought that up, so you don't have to touch a door handle, right? Or if it's a shared device, having the ability to not contact that as much as possible. And then I love how you said that, Alex and Jason, about paper records or health records. The virus itself, it might last up to 72 hours. We've seen a study from Johns Hopkins University be published that was in a lab environment. But the one that's not talked about is bacteria. Right? Bacteria remains, it's a living microorganism, and it still can remain on any surface for weeks or months at a time. So going back to proper hygiene, washing our hands the correct way, and then being able to share that with our children, it's really that effect. Low-hanging fruit is just practicing basic hand hygiene. I think that's the biggest shift, is people being aware of, how many times do I touch my face, right? Did I wash my hands the right way? Maybe I shouldn't touch that door, or if I do, maybe I grab a napkin or something to do that. And that will have an exponential effect. The challenge, though, still, there's many communities, for example, that don't even have running water. And if you look in the United States, you have the Native American population. That's really sad, but they do not have running water. And per capita, you look at the Navajo Nation, has a higher COVID-positive 19 patient population than, for example, Maricopa County in Arizona, as an example, or Utah. So you kind of have to do both. It's like, yes, we have to teach proper hygiene, but you have to understand there's limitations if you don't have access to water. So IT, we need to look at, hey, in my opinion, how can we leverage IT when possible, or technology solutions, to really that low-hanging fruit, and then expand that throughout the world.
I think the pandemic has exposed the cracks, the weaknesses in the system. And, whereas we were going to use old world, let's call them retrospective solutions, there's a staffing shortage in the NHS. Everyone knows it's true. There's something like, I think, 200,000 nurses that are needed in the system over the next, whatever it is, 5 years. The original thinking was, let's find more nurses and let's hire them. But then they're just not there. So now we're saying, well, actually, that's not going to work. So let's do something else. Let's figure out smarter ways where we need less nurses, or the nurses we have can be more efficient and serve more patients and solve more problems and do what they're really good at, versus the average healthcare professional spends somewhere between 40 to 70% of their time on admin, filling in paperwork, filling in computer, databases, punching in numbers. That is not useful time for that highly trained, highly skilled individual to optimize their value. So again, the NHS is an interesting one in that it's one of the best healthcare systems in the world, yet it has a huge amount of inefficiency.
Often, preventing sort of outbreaks of COVID-19 within a workforce obviously remains a huge priority, and often it is the IT equipment that is sort of seen as those potential high-touch zones that could cause the infection. So what sort of steps have you and your company been taking to address that?
So some of it, I think, kind of going back to what was said before, some of it is just very basic, and it's very good, just kind of good clinical, infection management type principles, right? So you have within a typical hospital environment often a lot of multi-user workstations, right, or multi-user devices. So you've already created not just a high touch point, but kind of a guaranteed high touch point between members of your staff. And we are before people are even getting to the building, we're obviously testing our staff regularly. We're kind of fever scanning at the door, the kind of passport control, security control type environment. For patients who are coming in for procedures, and this is both NHS and kind of private patients, because we're running as a COVID secure facility, right? So we don't have the infection issue. We have a whole volume of elective cesareans and cancer patients coming to us from the NHS who we kind of treat on a not-for-profit basis, because we have that infection manage that infection out of the environment. So there's a lot of stuff you can do before people get into the building. But once you're inside and you're looking at, it's really kind of peripherals. You're talking about swapping out. It's a bit of a kind of unfortunately, a kind of a waste aspect to it. But you're talking about kind of swapping out a bunch of technology, right? You've got to have keyboards that you can kind of wipe down. Right? If you've got things in grooves, it's just really not kind of maintainable. If you're looking at devices which are being used by nurses rather than having multi-user workstations, all of our nurses are out there with very cleanable, kind of clinically sound, well-managed kind of mobile devices to be able to kind of check on the patient's vitals, things along those lines, using kind of applications. So you can move a lot into that kind of personal technology environment. I think one of the challenges and it won't just be for healthcare, it'll be for other organizations as well, when you think about that kind of everyday tech that's in front of you at a desk, right, or at a work site. The biggest challenge, and we've talked a lot about virtualization, is you better have your own headset, right? Because that is not going to be something where you can say, hey, we'll hot desk, right? We'll limit the number of people coming into a workplace by these guys will be in this week, and then we'll do an AB shift the following 2 weeks. You can wipe down a lot, but right, you better have your own headset. But I don't think realistically it's anything more particular to IT than it would be to anything else, than it would be to door handles or a canteen tray or anything else. If you can switch those items out for things which are a little bit more manageable to keep clean, to keep infection free, then great, right? But otherwise, it's pretty much like anything else which is going to have regular contact with multiple people. You just need to have good policies and good procedures, and keep things infection free.
Brilliant, thank you. Okay, I'm going to change tack now. So I want to think about some of the issues relating to employee engagement. So the World Economic Forum recently released a study from Germany showing increasing cases of mental health issues amongst workforces operating remotely during the pandemic. And I think over 50% of German workers reported increased irritation, and a sort of a similar number talking about sort of quite severe disruption to sleep patterns. I think, at the same time, in the last few months, we've also seen the Black Lives Matter movement and sort of increasing demand from employees for companies to review their diversity and inclusion policies. So, Jason, maybe we can start with you, and then Mindy and Alexandra, I'll bring you in. But I mean, it would be good to get your thoughts on how best to manage some of these diversity, inclusion, and well-being issues amidst remote working, especially considering sort of the enormous pressures and demands of the healthcare sector over the last few months.
Well, you saved the easy one for me. Thanks. So I think we're at a very, very unique kind of inflection point. I think just a week or so ago, you saw one of the large payers in the U.S. announced that it was going to cover a bunch of different kind of mental health intervention apps, different types of interventions that won't traditionally be covered under your health plan. They're used to pharmaceutical interventions, but now you have these behavioral interventions that are produced through applications on your phone or a web interface. And I think those kinds of on-demand types of interventions can be quite powerful. Cognitive behavioral therapy has been proven to be very effective with many mental health disorders, even more so than pharmaceutical intervention for some. But making them available, again, sort of aligning those incentives, making them easy, making them free, paid for by employers so that people can engage with them. And it's something that I think employers need to do more of, or systems, if you look at the UK and a public system, need to make available to patients and to people more widely. As an employer, a small employer, some of the challenges of just maintaining those human bonds. Onboarding staff in the last 5 months has been a unique experience, right? How do you bond? How do you connect? How do you understand the culture of an organization if you've never met the people in it physically? It's a very unique and new challenge. As good as some of these teleconferencing platforms are, they're no real replacement for in-person interaction. So I think you need to make room for our history as human beings, where that kind of physical interaction, those human contact points have been so important, for our lifetime as human beings on this planet. And how do you combine them in a way that makes sense for the individuals who they're targeted at? It has to be easy to consume. It has to be able to meet the needs of those people in the settings they're in and at the times when they need them.
Absolutely. Mindy, would be great to get your thoughts on in terms of what you've seen from amongst your own team, amongst the businesses that you work with.
Yeah, I think the mental health issue of this pandemic is one of the largest potential fallouts that we'll see. And I say that from not just who I work with and who I talk to, but from my own experiences in my own wider family. That this has cut across the elderly and feeling like things that they used to take for granted and seeing people and going to the grocery store, they no longer feel safe in doing that. And they're feeling excluded in their end of life where all they really want to do is be around their family, to the middle age, which I include myself into that, to the younger generation. And I have a 16-year-old son who's finding it incredibly difficult because teenagers don't self-isolate. They're used to being around people. So this is a massive issue, and it's going to be a global issue around mental health. People are naturally like to be with each other and communicate and not have the social isolation. And working virtually is rearing up a lot of bad behaviors as well. So a lot of it is good, but some of it that I've been hearing is the ability to kind of really micromanage people and understand what they're doing. And productivity levels have gone up, but the blur between what's home and what's work and your family has become even more blurred in this, which is it was not necessarily healthy. So with regards to looking at it and engaging, I'm behind one new startup, which I'm very excited about, because if we look at mental health, it's not just about your healthcare. It is about your mental health. It is about your financial. It is about how you interact with your work and having new ways to engage. And I think many organizations have found this difficult. It's very easy to compartmentalize health, which is probably why we've gone after the physical aspects of it. But the mental aspects of it are so wide and diverse, and they don't just fit in one nice bucket. Mental health is not only just about a breakdown of spouse, a loss of, a parent being fired or financial insecurity, as well as your health. So this is an area that I think as employees, they're going to have to step into the void. Yeah, it's going to have to get a little bit more personal, because taking care of people on a virtualized area means you need to understand individually what's going on and collectively within that, and being able to pinpoint where you can support people without stepping across a potential information boundary. And that's something that I'm working with some of the brightest minds that have come from some of the big insurance brokers to actuarials in this space, that's making these type of solutions ready, accessible to employers, and employees understanding where they sit within that matrix and what they can do are incredibly important.
If I may, Jack, we're all fortunate we have jobs, right? We're talking about the employer and the employee relationship. But COVID-19 has caused a global economic devastation, right? If you look at the US, we've hit over 36 million people not working. I mean, put that into perspective. Imagine half the population of the UK not having a job. That's more than the population of all of Canada not having a job, and significantly more than Australia. Canada's about 36 something million, 36.2 million. And so with that in mind, this has caused conditions that really stimulate violence in families, where these did exist before, but these are worsening situations in homes where violence has been a problem, but it certainly accelerated the use of alcohol, accelerated the use of drugs to be able to deal with this. And the sad part is, the United Nations Population Fund, last week they came out with the statistic that for the 3 months of this quarantine will result in a 20% rise in intimate partner violence. And that equates to roughly 15 million additional cases. That's to children, to spouses. So because we're working, maybe your spouse isn't working, or maybe your partner isn't working. There's been some great programs put into place by employers, but this is an unprecedented fallout, like that truly Mindy was talking about earlier, that we'll see in the years to come. And I do like to call this out. I know, for example, in the United States, SAMHSA, so SAMHSA, if you're not familiar with that, this is the Governmental Organization for Substance Abuse and Mental Health Services Administration. They've really stepped up to provide resources. You can get on with a therapist. You can text message. So countries that are stepping up are trying to broaden technology to allow people to potentially at least reach out to someone and help, because you can't leave, right? If you already are in a violent home, before you were able to leave, you had access to resources, and you don't. So that's an area that we haven't really discussed, and that will have ongoing long-term effects, regardless of the age of that population, elderly, middle class, or children.
Okay, excellent. Thank you very much. So we're now going to move on to the final Q&A session. So we have some questions that were submitted by IT leaders and advocates within the Global Tech Advocates Network. So I'm going to do sort of quick fire questions, one for each of you. So starting with you, Daniel. So the question is, what IT solutions and technologies have allowed you to continue operating during the pandemic?
Great question. We're fortunate, right? Because we are HP, and so we have the accessibility to technology, right? We produce the computers, we produce printers, we produce, we help build out infrastructure. So we're a fortunate company. The IT solutions and technologies, we were able to quickly ramp up a work at home structure, and be able to ramp that up in a very short matter within a couple weeks, to be honest. The other thing is we don't have the challenges when it comes to protected health information, as an example, like a healthcare system has. And so because we have a very strong security presence, yes, people had to adapt to working at home. The only warehouses or factories that we kept open, they were just for the essential workers to continue to produce technology. But we did have to shut down as we've continued throughout the world. When it first started in China, then we had to shift to production in European countries, and then it hit Europe, right? And then we had to shift to the United States. So we've been very fortunate, but many companies, that's not the case. And then if we look at healthcare itself, as an example, I know Memorial Sloan Kettering in New York, they went from 3,000 work-at-home employees to, in a week and a half, 23,000. And so how can you have clinicians that are not patient-facing, not critical, those elective surgical, procedural clinicians working from home, setting up the correct securities and protocols of exchanging data? So we've seen a lot of those challenges. So I'm answering it in two ways. HP is not I don't feel is a good representative when we're looking at compared against healthcare organizations. But we've had challenges. I feel like everyone has. Mental health is starting to come to the forefront. I think the best thing that's happened for HP is being able to be aware and acknowledge that, we do say we're a diverse company, but we need to have more diversity. Technology is typically not diverse enough, in my opinion. So we've had a big shift in having a very open forum with all people of all, when it comes to the LGBT community, when it comes to African American population, when it comes to the Latino population. coming to the table with our executive leadership. And that was a really good thing to be able to experience and move towards. So that's what we've done at HP.
Excellent. So, Mindy, the question for you is, what health tech innovations do you think will emerge as a result of the pandemic and define the next 10 years? And do you think we'll see a significant rise in health tech investment activity in the next decade?
Yes, I do. We're already starting. We're already starting to see it, and I think what we're seeing is the environment to put money into this because of the attitudinal changes and just how much that healthcare has been a laggard with regards to technology and where it needs to go. So I think health tech is going to see a boom. I think that boom is going to be around moving from what I call the old environment to the new environment, which I'll classify that as a lot of things have been done in healthcare that are around auditing or reporting that are retrospective, which are all really good and need to happen. But I think we need to get to more real-time, preventative, predictive type of technologies, because once we do that, our efficiencies will increase. Operationally, we will become better. And if we're better operationally, it'll have an impact on patient safety and clinical negligence. They're tied together and they're currently two separate buckets of very large expense. So we're going to see that big shift, and we're starting to see it. And there's going to be lots of challenges around, using AI and machine learning and quality of data, but we will embrace those type of things. And so I really think that the future is going to be very different than today. And I say this often. When I first moved to London, there was one skyscraper in the city. And if you would look across London now, it's a multitude, and we've got Canary Wharf. So in 20 years from a commercial real estate, wow, what's changed. So I think when we look a little bit on a different timeline, what we don't know is just how much it's going to change. But I think we're going to see fundamental shifts in people to play space, to how we bring people together, to a predictive and preventative environment that's going to come across the board. And consumerism, I think, ultimately will be driving choice and better outcomes. Yeah.
Fantastic. Thank you. And Jason, coming to you next. So, what practical advice would you give to a health tech company looking to sort of sell its services right now to a large healthcare company or provider?
I do a lot of mentoring and accelerators and advising companies. Usually, even outside of this very unique period that we're in, it's really important to ensure that you align your incentives with those of the organization you're looking to engage with, whether it be the NHS or a large healthcare provider like an HCA or a pharmaceutical company. You have to understand what the problems are that they're trying to solve. Unfortunately, many solutions are solutions in search of a problem. We're trying to shove a square peg into a round hole. We've got this technology, isn't it great? Why don't you want it? But we don't fully understand what the problem is that people like Alex and others are trying to solve. What are they trying to solve for? Maybe we can improve this very small slice of their problem, but they've got this big a problem they're trying to solve, and if just this little bit, it's not worth the risk and the challenge of trying to integrate that when I've got this problem to solve. So it's really about understanding, very, very deeply the needs of your customers and your potential partners and how the system works. In the NHS, we talked about it earlier, there's 10,000 payers in the NHS. There is no National Health Service. There's lots of different incentives aligned across the system. You need to know the incentives and the interests of that particular individual you're trying to engage with. And rather than being kind of a sales or technology-led organization, it should be a customer needs-led organization to really understand the needs of those providers and those people that you're trying to engage with.
Excellent, thank you. And finally, Alexander, quite a broad question to close on for you, I'm afraid. How do you rapidly scale your IT capability to meet a surge in demand?
With a lot of 60-hour weeks back to back, that was definitely part of it. For healthcare, it's slightly different. We talked a little bit before about you have a lot of kind of laggard industries, right? You have a lot of fortress IT, you have a lot of on-prem IT, right? You don't have the there are very few internet native hospital providers, realistically. But in terms of scaling the capability with areas which are not necessarily kind of net new, but net new at scale. So if you're talking about virtual consultations, virtual primary, if you're looking back at your existing infrastructure, which will be, a spectrum of kind of legacy at one end and kind of, cutting edge at the other. If you're looking back at that and you're looking at your on-prem, internally managed technology estate, and you're asking yourself the question, how can I scale this? Then you need to turn your face in a different direction. You need to be, looking at the cloud. You need to be looking at kind of partnerships. You are not going to, kind of create more comms rooms and rack up to give yourself any scale. You've got to look at the industries outside of healthcare and say, what did everybody else do maybe in the last kind of 5, 10, 15 years? And, it seems to have worked. Why don't we follow that path?
Excellent. Well, look, thank you very much, everyone. So that brings us to the end of the webinar. And I suppose just a few thoughts from me to sum up. There's been lots of the discussion today has been very optimistic. And we've talked about these sort of vast attitudinal changes. We've talked about the incredible increase in virtual environments and the use of digital health solutions. So maybe going back to your point, Alexander, on the return to work strategy, you won't get things right on day one. It feels like this is a process and a journey, and hopefully that attitudinal change is enough to ensure that the future is looking bright for healthcare and health tech as a whole. So thank you to all of you today for speaking with us and sharing your thoughts. Thank you to everyone who has joined us to watch this webinar as part of the School of Thought Managing Change in the Age of Hyperacceleration series from HP and Global Tech Advocates. We will email everyone who has registered to watch this webinar and invite them to become part of our GTA and HP community. We have also created a GTA and HP community LinkedIn group. So if you'd like to continue this conversation, please feel free to join that group. Thank you very much, everyone, for watching.
Thank you for watching. If you wish to continue the conversation as a part of the HP and Global Tech Advocates LinkedIn community, visit hp.com/HP School of Thought, as seen on screen, and click Join Now.